Hello, I'm Celia, one of the nurses from Page Hill Medical Centre. I'd like to show you how to do a finger prick blood test. I'm going to use one of the most commonly available machines, but if you need any advice about a different system, most of the manufacturers have YouTube videos on their websites. So first of all, you need to make sure that you wash your hands and dry them very thoroughly. Next, you need to get your kit ready. So you need a finger pricking device, lancet, pot of strips, your machine, a sharp spin and a bit of tissue or a piece of cotton wool to blot up any excess blood. Okay, so first of all, take our finger pricking device, and first of all we need to load up the lancet. So we untwist it at the end, and that twists off. Take our lancet and that just pushes straight in like that. So there's the little end here, which is the little safety disc. You just need to untwist that and hold on to that, and then the end goes back on. Twist that back on. Next, we need to alter the depth. So there's an arrow there and there's a set of numbers around the side. Most people, the depth of the needle going into the skin, and number 2 is sufficient, but if you find when you're doing it you might need to change it to a number 1 if you're getting too much, or up to a number 3 or even 4, just depends how thick the skin is on the fingers. Okay, but most people start off at number 2. So that's that on and there. Next we need to prime it. So we pull the other end of the finger pricking device until it clicks. That's already primed, and on this device there's a little red indicator button there that shows it's already primed, but not all of them have them. So that's all ready to go now. So next, take our pot of strips, and you need to make sure that the name on the strips is the same as the name on your machine, and also that the strips are in date. So you flick the lid, take out a strip, and we've got a black and white stripy end and a pointy end. So it's the black and white stripy end that you need to insert into the strip. Pick it up. It can be very fiddly. And that slips into the slot at the bottom of your machine. That turns the machine on, and then it indicates on the indicator that you need to take a blood test. So you get back to your finger pricking device, already primed. Choose a finger, and the site of your finger prick needs to be the sides of your fingers, not the pads. Anything that you can touch the table with, you need to avoid finger pricking, because that's where most of the nerve endings are, and that's what you use to pick things up with, and you want to minimize the damage. So down the sides. So any finger, using this other finger on the trigger on the top, push quite hard. There we go. Then wait a few seconds and then just squeeze gently the ends of your finger, and a blob of blood should appear. There we are. So we take our strip we've already put into the machine, and then the strip needs to go into the blob of blood, not the blob of blood onto the top, otherwise that won't work. The strip goes into the blob, and the blood then travels up the strip and into the machine, and gives us a number in about 5 seconds. So next we take a bit of cotton wool or a piece of tissue just to dab off the excess blood on your finger. So that's your test all done. So we now need to get rid of that used lancet. So to do that, you untwist again, and there is the exposed thing. And remember that little disc we had before, the little green disc, either put that on the table or on the top of your pot, and then the needle goes directly into that little disc. So now this is now safe to either get hold of and pull out, or on this particular one there's actually an ejector button. So you take your sharp spin, and then with your thumb you just fire that straight into your sharp spin, and that's it.